Shield. Joining us live in studio now is Dr. Mark Hiatt. He's the Executive Medical Director of Regence Blue Cross Blue Shield of Utah. Doctor, always nice to have you here in studio. Let's talk about joint pain and the weather. Because you know people who say that they can tell rain is coming by the pain in their joints. Is there any basis at all to some of these claims?
Brian, there may be some basis. You know, people do believe that they may be able to predict the weather based upon the symptoms in their joint pain.
Mm-hmm.
But a recent study failed to show a connection between the weather and joint pain.
So what was this study and what did it show then?
Well, Maria, what researchers did is they analyzed Google searches, and they found that there were more Google searches on the Internet related to joint pain when the temperature rose.
Oh, interesting.
Isn't that weird? So why would searches increase when the temperature increases?
Well, the researchers, Brian, believe that because people are more active during nicer, warmer weather, that they may be also more prone to injure themselves or to experience joint discomfort because of overuse.
Okay. All right.
So any connection between the joint pain and rainy, damp, and cool conditions then?
Well, it's interesting, Maria. In this study, they actually found that searches for joint pain actually decreased when it was raining outside.
Oh, that's so
So they couldn't substantiate that claim that there's joint pain when the weather is damp.
All right. Let's move on to how many Americans live too far away from a hospital where critical care services are really lacking. How many Americans are we talking about here?
About 30 million Americans,
Really?
Brian. A recent study estimates that nearly 30 million Americans live an hour or more away from trauma care.
Wow.
Okay, so that's got to be serious. I mean, what does that mean for Americans?
Well, that means their emergent needs may not be met in a timely way. We're talking people with heart attack, with stroke, severe bleeding. They may not be getting to a hospital in time.
Okay, let's move on. Final topic here, fidget spinners. These are all the rage right now. In fact, Amanda gave me one just last week. I have one on my desk right now. But there are some warnings to watch out for these things, aren't there?
That's right. In fact, there's this recent case, Brian, of this 11-year-old in Arizona who actually got one of these stuck on his finger.
Oh, no way.
And they weren't able to remove it. For 16 hours, he had this gadget stuck on his finger.
They couldn't get it off of his finger.
Yeah, what did they do?
Well, ultimately, after a few doctors in two different emergency rooms attempted all the usual methods, eventually a hospital maintenance worker was able to saw this thing off with a sturdy, sharp saw.
Okay, now on the other side of that, are there any medical benefits perhaps from these spinners at all?
Well, this toy has been advertised as having certain benefits in helping people with trouble with anxiety.
Okay, calming effects.
And so it's thought that by relieving their nervous energy or their psychological stress, these fidget spinners may help.
Okay.
All right, Dr. Hiatt, thank you so much.
Always good to chat with you. Thank you so much. And this portion of Utah's Morning News is brought to you by Regence Blue Cross Blue Shield. KSL News Time.